Tell you. But thank you very much, though. Thanks. Okay, and today we got Mayor Pro Tem, Dave Martin, Chief Pena, Dr. Purse, who are with us today. Today, the Houston Health Department reports 267 cases of COVID-19, bringing Houston's total to 70,064. So that's 267 positive cases. Of the 267 cases reported today, 43%, roughly 115, have specimen collection dates within the last 14 days. We also have 7 newly reported deaths, unfortunately, bringing the city's total to 998. We are only 2 deaths shy of reaching a grim milestone with 1,000 COVID-19 related deaths in the city of Houston. And as you can see, those deaths cover some in July and some in August, but none of those 7 are in the month of September. I also want to share the sad news of another City of Houston employee who passed away of COVID-19. Richard Sable was a City of Houston employee who started in 2010. So please keep his family and former colleagues in your thoughts and prayers. Since the start of the global pandemic, the city has lost 7 municipal employees and 3 firefighters. Yes, if you take a look at all of the individuals, these are city employees who have lost their lives as a result of COVID-19. Certainly want to acknowledge their dedicated service and commitment to the city of Houston, and we want to lift up all of their families, relatives, and friends. The virus continues to be a threat to people in our city, whether you're a city employee, just any person that's living within our city. We will continue to monitor the numbers for this month and next month in October. The city of Houston's numbers are better overall, and that is because we have encouraged people almost every day to take the virus seriously and to do their part to stop it from spreading. We are also taking a cautious approach rather than an aggressive approach, as I indicated to you about a week and a half ago, as we deal with how we move our city forward. And we want to move our city forward, but we also want to do it in a way that will not only slow down the spread and contain it, but to crush this virus. For instance, last week we announced a limited number of special events that would be allowed if they follow the health and safety guidelines set forth by Dr. Purse and the Mayor's Office of Special Events. As an example, the Houston Symphony is holding its event at 25% capacity. And if you notice, the Jones Hall can hold up to 3,000, but I think they're only permitting about 150 persons at the Houston Symphony, and I want to thank them for that. I had the opportunity to listen to the governor's remarks today, using the hospitalizations as a determining factor for the spread of the virus. I know he is allowing restaurants, retail establishments, gyms, and others to open at 75%. That is a little bit more aggressive than I would prefer in announcing the next round of reopenings for restaurants, retail stores, office buildings, manufacturing facilities, gyms, and exercise facilities, museums, and libraries. And this is especially so because we are right now in the midst of approaching the flu season, and many of our kids are returning to school at certain levels. Those learning virtually will soon be in the classroom in a matter of weeks. The state has taken an approach that comes with high risk, and again, a little bit more aggressive than I would prefer. The governor is only utilizing the hospitalizations as the primary matrix to make decisions about reopening, and hospitalizations, bear in mind, represent a lagging indicator. It's also, let me just say that I look at the TMC's analysis every single day. Today, they did not post the effective reproduction rate that gives you some sense of community spread within our city, within the 9 county areas. So, for example, if the reproduction rate is below 1%, it means that the community spread has slowed down. If the reproduction rate is greater than 1, that means that the community spread is very much in our community. This morning, they did not report a reproduction rate at all. And I think because of the Department of State Health Services is updating its data so that reproduction rate was not included. That is important in determining the level of community spread from their perspective. But let me just say this. You know, we have been here before. Our hospitalizations were low at the end of April, but then those numbers shot up dramatically, and the results were horrendous. Houston is still reporting too many positive cases and death at a level higher than March, April, and May. And going back to March, we had about 1,500, a little over 1,500 cases, as you can see on the sheet, on the screen. In April, that number was 3,200. In May, it was roughly 3,800. In June, it went up to close to 13,000. In July, it was over 26,000, and the number goes on and on. So in March, April, the numbers of hospitalization was low, and we reopened quickly. And then if you look at the number of reported deaths in the city of Houston, in March, that number was very low. And then in April, that number was 106, then in May 89, in July as many as 435. So the numbers went dramatically up. And so it's my hope that it will not, what we saw that happen in May when we reopened as quickly as we did, will not happen again. But you know, I would caution anyone from claiming any sort of victory over this virus. This virus has not gone anywhere. This virus is still within our city. We still need to take this virus very, very seriously. To the extent we come together and we don't wear our masks and we don't engage in proper hygiene, again, this virus will remind us that it is very much present. So even though our numbers are much better than they were, for example, in June and July, even in August, our positivity rate is better. We reported at the beginning of this week, our positivity rate was 6.1%. But the goal is to get that positivity rate to 5 and below. And not just to get there, but to keep it there. That's the goal. We are not at 5% and below. It hasn't been at 5%. We haven't been there, and it stayed there for at least 14 days. And so let me just put forth a cautionary note. You know, as much as we all want things to move forward, to get back to normal, we are still not in normal times. And I would urge Houstonians, to continue to follow the proper medical protocol, to continue to get tested, and then to be very mindful of your behavior and your conduct, which could lead to a greater community spread. We have come too far since we reopened the first time, and far too many people have lost their lives. Far too many people have lost their lives. Far too many people have gotten infected with this virus. And now as we begin to approach the flu season, and our kids are starting soon to go back to school, this is not the time to take an aggressive approach in dealing with this virus. Let me pause there and bring up Dr. Pearce.
Thank you, Mayor. I have a couple of thoughts to share. One is that earlier this week, we reported the positivity rate of 6.1. Keep in mind that that is based on a very small amount of data from the previous week. And as we get more data coming in, What we've seen in the previous weeks from that is that the number tends to bump up a little bit. So while 6.1 is good, and we've said the numbers are coming down, but as we look towards 5%, remind everyone there's nothing magical about 5%. So as the mayor says, once we do get to the 5%, we need to keep on going and get it down lower. And again, I challenge Houstonians, since New York City is at around 1%. If New York City can do it, certainly Houston can do it. So we have a lot of work to do. That also, when we start talking about percentages, and the governor's statement today, he talked about hospitalization, the percent of patients who are hospitalized, and that with COVID, what percent of the hospitalized patients are diagnosed with COVID. And that's going to be used looking at the trauma service areas. And so the state of Texas is divided up into 22 trauma service areas. And for this region, it's a 9-county region, and it's each one of those is lettered. We happen to be trauma service area Q, as in Quebec. And for our 9-county area, the current for all hospitalizations is at 6.9%. So that's you know, and it's way down from what it was. So again, the numbers are going down. The governor talked about a 15% threshold. We're way below that. My concern is that we need to keep that number going down. And if it changes direction and starts going up, depending on how quickly it goes up, we'll have a lot of time to know before we get to that 15%. And so I'm a little curious as to what's going to happen between 6.9 and 15%, what we're going to do as a community. But what I would like to think is that we never find ourselves in that situation. We have certainly learned that by wearing masks and social distancing and doing all these other things, that they work. They really work. There is no vaccine. What is changing the numbers today is the behavior of Houstonians and all of our friends and neighbors in all of Southeast Texas. And so as we continue to do these things, this is what empowers us to protect our community, and that isn't going to change. We have to continue doing that. So even though the governor has made his announcement today, that doesn't change the way the virus behaves. It doesn't change how it will take advantage if we drop our guard. So let's not drop our guard. Let's keep it up. Let's fight the fight, and let's crush the virus.
Chief Pena.
Thank you, Mayor. For the fire department, we also continue the positive trend downwards for our quarantine of personnel. Today, we are at 43 firefighters that are in quarantine. We have 26 that are positive for coronavirus. They're all recovering at home. In regards to our occupancy task force, with the opening up of gyms and restaurants and other businesses up to 75%, we anticipate our call volume is going to go up for complaints. Please bear with us. We do know that the calls are going to come and they're going to go up, because 75% occupancy doesn't look much different than 100%. So we're going to be, we anticipate being busy, but the Houston Fire Department is going to continue to be a resource to these businesses to ensure that we're doing the right thing in meeting the intent of the governor's executive order, and we're providing a safe space for people to attend these businesses. I would recommend, as the mayor has emphatically stated, that we maintain wearing our masks, physical distancing, and proper hygiene. That's really going to be what's going to help us achieve our goal. And it is the best recommendation we have at this moment. So with that, that's my report, Mayor.
Okay, we'll take any questions anyone may have.
Okay, this question is from KTRK. Can you talk about how you feel about the governor's being too aggressive, or are you worried about it being too aggressive, and about there being more cases? Either you or Dr. Peirce.
Yeah. Well, let me preface it by saying that, we too, and I certainly do want to move forward. And I think we all want to move forward. So I think we're all in agreement with that. We all want to move forward. The question is how fast do we move forward? And I think it's with this virus and the absence of a vaccine, and recognizing that it's still in our communities, that a more cautious rather than aggressive approach. Bear in mind, we've been at this juncture before. At the end of April, when the hospitalizations were low, and when the community spread, what seemed had been slowed, the state reopened, and reopened much quicker than I would have preferred. And then if you put the charts back up, Is this the cases? Yes, this is the case. So if you look at, if you look where we were, for example, in April, towards the end of April, and then when the state opened things up, then you see how the progression of the cases in May, in June, and July. And we worked feverishly to try to get control of what I described at that time as a forest fire. The same thing, those are the number of cases. If you also look at the number of people who died as a result of COVID-19, you see the same thing that took place with regards to the number of deaths. You look at where we were, for example, in April, and then take a look in May, June, July, how things just jumped up in terms of the number of deaths. So the preferred course would be to move forward, but to be more cautious rather than aggressive, because the positivity rate still needs to go down much more. As Dr. Peirce said, we're not at like 1% in New York. And in Boston, I think it's right around 1 or 2%. You know, the last number that we reported was 6.1 for this week. So we still need to crush this virus. And until that is done, or a vaccine, an effective vaccine comes on the scene, it's better to be more cautious than to be aggressive, especially when we are about to approach the flu season, and many of our kids are getting ready, for example, in a few weeks to return to campus learning. So that's my concern. The approach I believe that the state has taken comes with high risk, and also we don't want to confuse people and people thinking that this virus has been conquered. And so I would caution anybody from even saying anything where it seems as though where you're claiming victory over this virus. The mission has not been accomplished, and you can't claim victory over this virus. We are still fighting every day to convince Houstonians to keep their masks on and to put it on, to engage in social distancing, to wash their hands, to get tested, because this virus needs to be taken very seriously. So that's my concern. You know, I announced a week and a half ago that we were starting to open things up. But I would prefer a more cautious rather than an aggressive approach. And I think taking things to 75% in terms of being open, I think is more aggressive than I would prefer. Dr. Peirce.
Yeah, I would just add two things. One is that using the hospitalization number, the advantage of it is that it is a more rapidly determined, and it's a pretty firm number, whereas cases and positivity rate, there's a little bit of fluctuation with that. The problem with it, however, is that it's a late indicator of what the virus is doing in your community. By the time people get sick and wind up in the hospital, and the percentage of the occupancy of the hospital starts going up, that's a pretty late indicator. So there's the problem with using that. And then the other thing is that remember that at the same time here, you know, schools have just recently started to reopen. And while we know that kids will probably do fairly well for the most part, not all, but for the most part, kids will do well. It's not the infection of the kids and the spread of the virus on the elementary and high school campuses. It's the spread of the virus in the homes that is going to come a couple weeks later, and then those folks will get sick and wind up in the hospital. So the timing is that we could have two things moving in the wrong direction at the same time, and we're not going to know that for a couple of weeks now. And as the mayor pointed out, and as we all have lived, you know, putting the brakes on this and turning things around, let's face it, the virus gains a bit of momentum, if you will, and you can't change course quickly. And so I agree with the mayor. I probably would have waited and had a better idea as to what's going on with the schools before I considered doing anything else.
So just looking at the chart here, are you concerned that this is when you realize what's happening, you will be in the middle of a flu season?
Well, I think that's one concern, and look, we don't want this to be deja vu. I mean, we've been at this point before. And I think everyone needs to bear in mind. In April, we were at this point before with the announcement coming from the state to reopen things, and people were claiming as if this virus had been contained. And so this is where we are now. The difference now, as compared in April, for example, is that we are now beginning to approach the flu season, and our kids are looking at returning to school. Okay? That's the difference. But you can't ignore the fact that today we're reporting 267 new cases. and 7 more people have died as a result. You can't ignore the number of people who have died in our city. We are at 998 people in the city of Houston, okay, in the city of Houston who have died, 2 short of 1,000. I can't ignore that. We can't ignore that. And as much as we would like to be 75% open, 100% open, the reality is the virus does not care. And then quite frankly, we have these news conferences at almost every other day. And the purpose of these news conferences is to encourage people to remember that the virus is present and to mask up. That's the purpose of the news conference. So we can't be fighting the virus and then at the same time fighting others who want to open up the state in a very aggressive manner at the same time. It's kind of working against one another, and that shouldn't be the case.
This next set of questions comes from KRIV. Mayor, the Texans are looking for the city and county approval to allow 15,000 fans into NRG for the Texans game. Given what you know right now, will you give Texans approval to allow fans? And number 2, what will go into the decision to allow and not allow fans into the Texans game?
And we talked about that about a week and a half ago. As long as they're following the protocols that have been outlined by Dr. Purse and our special events, as long as people are wearing the masks and I believe the capacity is up to 25%, then I think that there's a way to get it done. And that's what I'm saying. There's a way to move forward, but it just needs to follow the proper health care protocols, and the masking. All of those things need to take place. Dr. Person? Yes.
And next question from KRIV is for Dr. Purse. What will you recommendations be to the mayor regarding fans being allowed into NRG for Texan games, and why?
Well, I think we put that into the document of the guidelines that we provided the mayor, and we're providing the same guidelines to anyone who wants to have special events. Our goal is to protect the public, and these are really difficult times. And so, as we've said before, unfortunately, there's no eliminating the risk, it's managing the risk. And so, along with that, not only are we going to try to do what we can do from a organizational standpoint, but I think that the individual Houstonian needs to keep in mind that they get to make a decision too as to whether or not they want to go to an event where they think it may or may not be risky. And you may think that it's not going to be so risky. When you get there, you may not like what you see, in which case you should feel comfortable turning around and going home if you're not comfortable. So all of us have to manage the risk, both the city, the organizers of special events, and then individual Houstonians. They've got a voice in this as well.
My question to the mayor, managing the risk, not eliminating the risk. You have shown on the slides the great job that you have done with your team and the city in moving from a very bad situation that came with the radical opening in April, May, to what we have now, which you must be congratulated. But again, sounding fearful after you have this experience of a great job could make Houstonians to doubt your ability to move them away from another resurgence. So what strategies, what do you have in place to manage the risk and not trying to eliminate it by force?
And Dr. Purse said it, and I certainly want to amplify what he said. It is about managing this virus, okay? We don't have what is needed to eliminate it, but we certainly, within the best of our abilities, we can manage the virus as we move forward. And Dr. Purse, his office, along with Susan Christian and special events, they have put forth a number of protocols that will protect the general public, especially on events where the audience can be, in a sense, a controlled environment. And what I said like a week and a half ago is the 25% in that controlled environment, along with the wearing of masks and the social distancing and all of those other elements that go right along with it. If you follow the protocols that the city has put forth, especially as it relates on special events, then we are much more comfortable that we can continue to move forward and bring down the positivity rate of this virus. If you look at the protocols that we have put in place, I simply do want to discourage people from going to a 75% occupancy on anything right now, because I think that's much more aggressive than I would be comfortable with based on what I'm getting from the healthcare community, and especially from Dr. Pearson and from others. So there's a way to move forward in a measured way such that we don't repeat what happened in May, June, July, and August from reopening too soon, okay? So we want to open, but as we take the steps going forward, we want to make sure that we continue to take steps to go forward rather than seeing a large number of people who are testing positive and then a large number of people who are dying as a result of COVID-19. We don't want anybody to die if they don't have to, okay? And we don't want anybody to get positive, tested positive with that virus if it doesn't have to be. So if we can manage it, effectively manage it, then it's a win for everyone. And quite frankly, all of us have worked very, very hard to bring the positivity rate down and to bring that curve down, and it is going down. But the goal is to keep it going down and keep it down, to crush this virus, and not such that 30 days from now we are saying we're reevaluating what we did. Okay? Okay? Any other questions? Okay, thank you all so very much. Thank you.